Greetings all. Welcome. This is the Advisory Board of Health quarterly meeting for March 14th, 2023. We're meeting virtually. First order of business is to review and approve the December minutes, which were distributed via email and posted a draft to the website. Anybody have any issues, comments, or amendments to the December minutes? All in favor, just raise your hand. That'd be great. Perfect. No abstentions. No. Okay. Our first order of business is, so that's unanimously approved. The first order of business is the report from the Director of Health. So David, over to you.
All right, thanks everybody. Thank you, Kevin. The first thing I wanted to start with was an item that was in the our minutes from our discussion from last time, and that was our proposed budget. We wanted to kind of take an assessment and kind of revise the structure of the department, adding a new position as a full-time assistant director of health, making a salary adjustment for the sanitarian position, eliminating a part-time position, and just trying to make our department position more for the challenges that we're facing and the development projects in town. And you voted unanimously to approve those recommendations I had made. Unfortunately, in the review process, the town administrator has decided not to go forward with the assistant director of health position, and felt that we would be probably able to add the sanitarian during the course of the next fiscal year, but not immediately in July. So, you know, that being what it is, I just wanted to report on that to you, that that's not going to happen. At least not for now. Otherwise, I'm sorry?
David, just a quick question. What does that do in regards to all the inspections that have to go on with everything new that's coming on board in town?
Well, we have another kind of challenge that we're going to be faced with that I'll discuss a little bit later, and that is that the state has gone ahead and fully implemented the FDA food code. So not only do we have to deal with all the new facilities in town, we have to kind of redesign and restructure our entire food protection program, including becoming familiarized with new inspection forms, enforcement protocols, and it's a whole different way of doing what we've been doing for basically our career. We all knew the FDA code was going to come someday, but we never anticipated that it would, none of my colleagues as well, anticipated that it would have been just like turning a switch and all of a sudden the old code is gone and the new one's in effect. You know, we started training and started gearing up for the FDA food code in 2017. Of course, in the interim, we had a pandemic, and all discussion about food codes and training and, you know, getting yourself acclimated to this new process was totally put on hold until the end of February, when all of a sudden we were told, yep, it's ready to go. It's the law of the land now. So I did circulate and did send out messages to all of our food service facilities, announcing the fact that this was a change that was underway. So there's just a whole spectrum of things that we have to do. We have to change our website. We have to provide notification. Everybody's used to seeing ratings. We're not going to be able to do ratings in doing the new form because there's not a scoring system which was used as a basis for formulating the A's, B's, or C's. So there's no numbers associated with the inspection forms. So you ask the question, what are we going to do with all the new facilities in place? Well, we'll add that to the logistics of what we're going to have to accomplish by getting used to how to use the new processes, familiarizing ourselves with it so that we could explain it to people when we're doing the inspections. My guess, we're not the only department that's in that situation with respect to having to catch up with a new code, and but we are unique in the sense that we have an awful lot of new places that are coming on board that are going to be caught in the middle of this transition, because among other things, our fee schedule is going to have to be changed. I'll get to that. Our classification system for foods facilities will change because the definitions in the FDA system are going to change. So, Mac, to answer your question, we have a challenge ahead of us, and we're going to push and use the resources we have as best we can, and make the best of it. What else can you do? Just do our best. And so we are working internally. We're cooperating with other departments, trying not to invent the wheel in the messaging that we're putting out. Not getting a whole heck of a lot of help from the state health department. We also have a digital health department, so we do mobile, use the laptop to do inspections on a mobile basis. So that form had to be changed, and we had to send that off to our software company to get that done, modified. And we can't really use that until the state health department says that it meets their standards for what the form's supposed to look like. So I had a meeting with representatives of DPH today on that, and we're making good progress. Our software company's been really quick to turn this around. But in the meantime, the state is saying use paper, and we haven't used paper in years, and we don't really want to use the paper if we could do it digitally, because it's just much more convenient, and it enables the public to see the inspection reports online. But people are also used to seeing ratings online, and we're not going to be able to issue ratings for a while. I have to suspend them until we can come up with a new matrix for figuring out how to issue ratings in a non-scoring inspection system. I don't know. Did I answer your question, Mac?
Yes. Yes. Unfortunately, you did.
It's not going to be. It's not going to be easy, but it wouldn't be easy anyway, even if we had another person, because nobody really is familiar with how to use this new process. We're all going to be learning, from scratch. So, I'm confident. I have a great staff. We have a really great resource in our in Lori Romick, who's been doing our plan reviews. So all our new facilities, she reviews them, and she does a great job with that. Gives us good starting points so that when places are ready to open, and we are getting a few that are getting very close, especially up in the Federal Realty area, getting really close to opening. So we're in great shape in that regard, and she's also very, very facile with the FDA code. So she's very helpful in answering our procedural questions in how to use that. Yeah, it's going to be an interesting year. So one of the things that I did want to bring to your attention today, while we're talking about food, is as I said, we're looking at doing an adjustment to our fee schedule because restaurant classifications are changed in accordance with the FDA. The way the FDA defines food service establishments is according to risk, the classifications. And, you know, we use we currently have 4 classes of food service facilities, ranging from a class 1, which would be sort of like a coffee shop that doesn't really prepare any food, or a place like CVS that just has refrigeration units and freezer units, which we go in and check. So they're very basic, to a class 4, which of course would be our full service restaurants. Class 2s might be a donut shop that doesn't really prepare food. And then of course class 3s. Well, what's happened is with the FDA code, they've reclassified and redefined classifications. So the class 4s, which really for us had always been just full service restaurants, has now been defined as being either those facilities that utilize special processes for food safety, like smoking or acidification, and serve vulnerable populations, and only that. So that would be like our extended care facilities, and some of our shops around town that do things, vacuum packing, for example. So they would be class 4. So if you just take a look at this, what we tried to do was to keep the fees fairly close to what they had been. Keep in mind, we have not made an adjustment in our food service permit fees in the 15 years that I've been here. We've never raised our fees. This is the same fee structure that you see on the left, the 2022 fees. The current fee of $250 for a class 1, $275. That's been like that for 15, well, longer than 15 years, because I started in September 2008. So that's been there the entire time. And we never raised the fees because we were towards the high end across the state anyway. And felt that, you know, that was okay. On the right in green, we have some proposed increases, and they're not substantial. They affect some, and the bottom line is an increase. And if you look all the way down to the bottom, on the left, it's 56,000 currently. And with the total in that we're projecting now, it's 68. In part, that's because there's some new facilities. And in part, it's also because we have decided that we will, or proposing, and this is subject to your approval, and then it goes to the Board of Selectmen. We are proposing to assess a fee on our schools. We never used to, because the schools were being the food service program, and the schools was being run by the Board of Education, was basically run by the town, and town facilities are exempt from fees. We don't charge fees unless they're being run by a vendor, which is how we've arranged it with Parks and Rec. So, you know, the vendors at the beaches pay a fee. So we felt that since the vendor is now running the school's food service program, that they should pay a fee for a permit. And that's subject to your review and approval. Otherwise, everything is fairly close to what it was. We raised the price of the class 4s from $650 to $700. You know, not a big deal. One of the class 4s is our senior center, and that they don't pay any. There's no fee to them at Mather Center. But the other places, the other extended care facilities will be paying the $700 class 4 fee. We broke out the over 50 seats to under 50 seats on the class 3s, which we used to do that for the class 4s. Basically, they just get, for the most part, got pushed down to be a class 3 now. So anyway, my first order of business to discuss with you folks tonight was to ask you if you were supportive of these proposed revisions of fees. There will be no other fee changes that we're looking at. We're not looking at changing fees for our septic, for wells, for cosmetology salons. Everything else is going to stay the same, but fee schedule needs to be approved. It needs to be changed to accommodate the changes in the code with the FDA code. And this was about as equitable an approach that we felt we could make at this time. Didn't want to end up losing any fee income. And of course, it is going to necessitate more of our time just getting used to this new form for the next year or two. It's going to take a while for us to really become, proficient in using this, and it's going to be time consuming for us to be explaining it to the proprietors of facilities who are used to getting a number score and hearing, what the letter grade is. And the first question that we got with using the new form is, did I fail? And, there's no longer a failure. We have to define, we have to go through and work on our definitions and come up with all of that. We need to update our website to provide all the information to the public and to the food service facilities. We have to provide guidance to the facilities on allergens, food allergens. Yeah, a bit going on.
So David, when you say there's no failure, I mean, how do you discipline an offender?
Well, there's categories of inspection violations. So you still have a violation form, and they have these terms they use, and they're called priority, foundation, and core. So a priority is a violation that might have been similar to what used to be a failing observation, a violation that resulted in a failure. But instead of calling it that, now what you do is you give a time frame for correction. It may be as little as a day, maybe 3 days, necessitating that we either go out and do a reinspection or they provide us with some documentation that those violations have been addressed in the prescribed time frame. So, what we're working on is coming up with some language that equates a priority violation somehow to a failure so that you can have that connection, so you can have an enforcement piece so that if they don't do it, that, there's going to be some measures of, something that needs to be done. The one thing that is not on this list that I wanted to do, we have what we call a reinspection fee. That's not listed here, and I'm not sure why, but it should be. But I think that when we go to the Board of Selectmen, we'll call it a reinspection fee or a hearing fee, so that if we find that a place isn't correcting things in the time frame that they've been directed, that we'll call them in for a hearing and we'll assess a fee that way. So there's other tools, but it's a little trickier. It's like, that's why I say, it's not, before if you just gave them a number and say, oh, you have a 4-point violation, that's a failure, we'll see you in, 3 days or 5 days. And it's still kind of the same thing. We still would not wait, 2 weeks or something if there was something that put the public at risk. If the dishwasher wasn't sanitizing, we'd give them a day to fix it. And that'd be the same kind of thing we would do here. So it's just that I would say that if anything, the tools in the toolbox are a little weaker than they used to be. But it's a different approach. It's a different approach to doing this, the inspection program than we used to have. And for the record, Connecticut is the last state in the country to do this, to go with the FDA code. And we've been pushing for it for a long time. Just so it's not that we didn't want to go this route. And I say we, I'm talking collectively as other health directors and health departments really wanted to go with the FDA code because it really does represent the latest in science and research. It's just it's more involved than the other one was. So it's going to be more, as a result, obviously, it's going to be more work, even when we're familiar with it. I don't know how to say a previous inspection would take an hour. I don't even know what time investment there will be to do the inspections with this new inspection process that we have. But I'd say it probably would at least double our time just trying to figure it out. And you're sitting there, and the other part is sitting in front of in an establishment with the manager or owner of a facility, struggling to figure out where you put things and how you put things, where you mark it, and So anyway, it's going to be a process. It's going to be a process. So I pose to you right now this proposed fee schedule that kind of represents a readjustment and realignment of the classifications of food service facilities in accordance with the FDA code, and also adding a fee schedule now to charge our schools, not the schools, but the vendor serving the schools a fee, which we didn't used to have.
So what does the increase get you? I mean, this is about 12,000 here. Is that material in any way, or is it more to bring the fees up to date?
Well, the Board of Selectmen is always looking for offsetting our time in establishments with fees, and they've always been a proponent of trying to generate as much income through a fee schedule to offset the amount of money that it costs the town to do that work. So this will do a little bit of that. It helps offset some of that. It's not going to purchase us anything, but it does provide a little bit more of an offset for the time invested in doing this work. The other place I see a fairly hefty increase is in seasonal facilities, like golf course snack bars and, the snack bars down at the beach. We kind of leveled the playing field with them, with the class 2s, because we really do the same number of inspections for those facilities in the short period of time that they're open as we would do for a class 2 facility that's open year round. And that's because, they have, we have to pay more attention to them because they tend to have a lot of temporary employees who may not have a lot of knowledge in safe food handling practices. So we find we have to spend more time there. So that was one of the reasons why we adjusted the fee schedule from seasonal to just a straight class 2.
Right. So you expressed that the time that it's going to take with this new process is an unknown. Is that knowable in some state that has done this, or is every municipality unique in that there'll be no average?
No, I think it's like anything else that's new. It just takes you a while to get used to it. And,
Mhm.
and so, our first years, baby steps. And, once we become more proficient with this thing, we'll get better at it. But just we have to remember we just ordered a copy of the FDA food code. It's 680 pages
Mhm.
with all
Yep.
the addendums, and what we used to use was the Connecticut Public Health Code and the compliance guide, and that was, I think it was 75 pages. And
Right.
we've had that for, forever. So that's the problem is that it's just going to take a process. And at the end of the day, it's hard to gauge what other states have found, because they had converted years ago, and they had their own forms before they converted. Now, I suppose we can get an actual time. What does it take to do an equivalent of, say, inspection at, say, the Goose, that type of restaurant, from one of these like a jurisdiction that has a lot of experience in doing this. But
Mhm.
it's going to take us a while to get there. And the tribal nation in Connecticut, the Mohegans and the Foxwood, they've been using the FDA code for 15 years at least.
Yeah.
So yeah, we can get some data on that and know what it's going to take us. In fact, they're going to be offering to do some training to help get local health department personnel more facile with using this inspection format.
Got it. So,
So yeah,
given their limited resources, then, so what's going to be the trade-off? Will it be fewer inspections or, less depth per inspection? I mean, something has to be compromised then, right?
we can't go less depth because we have to learn how to do this and we have to do it right.
Okay.
So that's, to me, that's not an option.
Okay.
We know what places maybe we could kind of not spend so much time working with
Mm-hmm.
because they have we have a history of the places in town.
Yep.
So we know those places that we have to spend more time working with. And frankly, that's going to be our focal point,
Yep.
as we go through this, which is going to be a really good way for us to learn how to use the form and learn
Yeah.
how to do enforcement.
So
So
I mean, just to turn this into, maybe a more positive message, you're going to use a risk-based approach or use a risk-based approach more than you have been as a
yes,
way to address this. So,
yes,
okay.
that's exactly what it is. It's all risk. The classifications are based on risk.
Okay.
And the priority foundation and core are also risk-based.
Okay. Great.
And the inspection in all of those risk-based violations have a minimum time frame for correction as a requirement. So a priority violation needs to be corrected within 72 hours.
Okay.
We typically do that anyway, and that would be something like, as I said, if we go into a place and the dishwasher isn't sanitizing, get that taken. And it happens, they run out of sanitizer, and so, or the water's not on at the hand washing sink. These are things we find, and a lot of these things can be corrected on site, and that's another thing that this inspection format allows for, is an on-site correction. So even when the public reviews the inspection forms, they're going to see stuff that's going to be conveyed in a different fashion than the way it had been before. So, it's going to be an education process for everyone.
Yep. And how will the establishments learn of this change? Is it something they'll learn on the first inspection, or, when information is sent out about the fee increase? Just curious how is communication going to happen?
We're going to do it in stages. We already sent a notice to all the food service facilities advising them that the FDA code is in effect.
Okay.
And also some bullet points as to the major impacts that that would have, focusing on the fact that we weren't going to be scoring any longer, that it wasn't a numbers-based inspection report anymore. It was risk-based, and also that ratings were going to be suspended. But one of the things that the code also mandates is that establishments provide patrons with either the most recent inspection report, or with the ability to view the most recent inspection report. So what we did was instead of having a rating, what we've done is we developed this placard, which would be put in the window where the rating used to be.
Mm-hmm.
And it says, the inspection report is available for public review upon request, or if you want to look at it using your smartphone, you can, the QR code will pull up, will bring it right to the part of our website where the inspection reports are hosted. So that's in lieu of the ratings. And this meets the requirements of the FDA code that says, you have to make your inspection reports available to the public if they want to see it. So we're going to be bringing this as we go around doing our inspections, like the way we would also deliver our ratings when we did an inspection. So this is part of the notification process. It's going to be as we go. There's other things that we're going to have to notify facilities for, and that's the allergen training. Every restaurant manager is going to have some training in allergen recognition, and also be training the staff in knowing how to react, and also just information that needs to be provided to staff and to the public. I think that this will also involve modifying menus. This is all part of the FDA code. This isn't Connecticut stuff. No, so it's not Connecticut centric, and it's just, this is what the FDA code has as a requirement.
Okay.
So we'll be delivering information. There's so many different things that are going to need to be done over time that we didn't want to do it all at once. It's like, okay, we're going to do this. There's more information, and we let people know there's going to be more information coming, but just get ready, be aware. We have a new code. It looks different. The inspection report's different. We're not going to be doing ratings, but this is what we're going to do instead of that. And so for the time being, until we can figure out, as I said before, how we can come up with some kind of rubric or matrix to equate those priority violations and priority foundation violations to a rating, we're just gonna, I think it's good for all of us. The other departments, there's 8 of us that do ratings in Connecticut, and just to kind of hold back a bit and see, after the inspectors get used to doing the inspection reports themselves, how to add that other level of evaluation to the inspection itself.
Right. So I know you said it was a challenge, but based on everything you've said, it seems like a very well managed challenge. You're communicating proactively. You've thought about implementing this in phases. So all of that, sounds great to me. I just have one other question, which is, some of this is about behavior change, and there was certainly awareness of the letter and that was showing in a store's window, which I think was certainly motivational to the establishment. So that's removed, right? That instant ability to look. I mean, I've gone to some restaurants in Darien and seen a lone rating, and I've seen the restaurant staff looking at me like, "Oh yeah, we know." So, um, without that, then what do you think will replace that? Will it just be kind of in the inspection itself? I mean, I feel like we're losing one of the levers that we have to promote good behavior.
We had a committee prior to COVID. We had a committee that was it involved all the all the health departments that issued ratings that was working on this, and we were pretty close to coming up with that matrix to do rating in conjunction with this. But what happened was that the rapidity of having this thrust upon us the way it was, without really any training at all by the state. I mean, we have not had a single session. In fact, the forums themselves were not available for the first 3 weeks that this thing was in effect. So there's been no training on just how to go about it, or refresher work and how to go about something that most of us had the training in 4 years ago. So what we need to do is to kind of get past, you're right, Andy, you're absolutely right. I don't want to let the ratings go for too long.
Mm-hmm.
It's a suspension. They're staying in the digital format, only right now, instead of having it be a required field for us to fill out, it's optional. So I'm hoping that at some time in the next few months, and I say that I'd like to do this, sometime 2023, to go back to issuing ratings. I'm hoping that we're just talking about a temporary suspension until we can all get together again as a group, instead of just trying to learn how to use the form, how to interpret it, so that take it to the next level. But that is something that I think all of us who issue ratings, and all the communities that are served by health departments that get ratings issued, really have become used to seeing that.
Yeah.
And I'm a strong proponent for having this go forward, but I think that I don't want to bite off more than we can chew at this point.
Okay. Thank you.
Welcome. So I don't, as I said, we did have our software company update our mobile inspection form, which needed to be approved by the state health department. And I had a meeting with them this morning, virtual meeting with them this morning, to go over some details on some minute changes that they request to be made on the form before we actually use it officially. So the good news is that they're simple. They're simple changes that need to be made, and I think we can make them and actually start using that form in the field, hopefully as soon as next week, which will mean then that those inspection forms will be on our website. So by that time, I want to also make sure that we have an explanation on our website for people who are used to seeing those ratings and seeing something completely different now. So that's the deal. It's a big one. And as I said, we had all thought that this would be something that could have been phased in over the next couple of months, but it hasn't been. The first training scheduled that I know of at this point in using this new format is not until May.
Yeah.
So, we're going to be muddling through for a while. And, you know, the good news is that, you know, we're working together. Other health departments have kind of banded together to figure this out because we're not getting any real leadership from the state. So, you know, we're out there and we have to do it. And so we are sort of. But I would really like to know if we can go forward with that fee schedule proposal.
We'll
okay
make a
with me.
motion to accept it. Anybody opposed? Okay, so I'll note unanimously approved, David.
Thank you. Just a couple things that I wanted to say about COVID. We've had a test center located at the church, St. John's. They've been there for, I don't know, a year and a half. Due to lack of interest, they will be ending their services at the end of March. The other one, as you know, in Leroy West, they've closed. They packed up and went home. I guess there's enough at-home test kits right now so that people don't need to go to these places and get tested. But I think one of the things that I did want to share with you is this chart. And this chart is kind of the it's one of the state databases that show cases. And I thought it would be somewhat illustrative to show it in the context with total cases, tests, deaths, and the last 7 days. These are all cumulative numbers. So if you look at the last column to the right, you can see that for the last 7 days, several communities have had no positive cases reported. That would include Darien. That's as of the 8th of March. We've had a couple cases since then, but for all our contact tracing efforts, we're finding that people are not as seriously ill as they were when the pandemic first started. The other item of interest, I think, is with respect to the number of deaths. And you can see for Region 1, which is an emergency preparedness region as established by the state, we're in Region 1, Darien had a total of 17 deaths attributed to COVID. One thing that's important to keep in mind with that is that may not have been the cause of death, but the person had COVID when they passed away. So it's really hard to say that 17 people actually died from COVID, or that in Bridgeport 150 people died from COVID, but that was one of the co-related conditions that folks had when they were at the time of their passing. Darien at 17 deaths had one of the, if not the lowest percentage population-wise of fatalities associated with COVID in Region 1. I think maybe Easton might have been a little less. But you know, 17 is still 17 people affecting many other people around them. But you know, in the context of some of the numbers in the other communities, Monroe's a fairly comparable population-wise. New Canaan also is significantly more people. But I just wanted to share that with you. The good news is where we have been the last 7 days, and you know, and then there is our trend. So if you look at this, this is our trend monthly from the beginning of the pandemic. And you know, we anticipated a a spike in the holidays. We sort of had one in December, but it was early December, really. Seemed to be after Thanksgiving, and after Christmas and New Year's, we didn't seem to have that same spike in January and in February. Not sure if we could attribute that to the fact that people were just getting tested at home and weren't going to one of those laboratories that report the tests. But the good news is, again, we've been saying for quite some time that these numbers that are reflected in our reports are only are not intended to represent hard numbers, but only to indicate trends. And the trend is in the right direction, down.
So what's what's the health department's current recommendation with respect to masks or boosters? I don't even know if more are available since a few months ago.
I think that it's sort of, we're back to saying to people that they should talk with their doctor. Get your advice from your physician. What does he or she think is best for you? And, and if you're not comfortable with being out in crowds and you feel more comfortable wearing a mask, well, wear a mask. Do the thing that you feel is right. I use mass transit. I'm on the train, and there are still, a fair number of folks on the train who wear masks. And you should have that right to be able to wear a mask without be judged by others for wearing that mask. It's whatever you're comfortable with. Same thing, being in crowds. I wouldn't say, you're perfectly safe, but the good news is, again, the severity level of illness isn't what it was back when the pandemic started. So that's not to say it can't come roaring back at some point, and have a much more dangerous characteristic. But right now, it's being described by many as being a cold or cold-like symptoms. Are there any other questions about COVID? Don't think I had any other slides for that. Did not. So the only other thing that I wanted to discuss, I think, was we did have radon test kits, free radon test kits that we gave to the public, and we gave them all out in like record time. We only got like 30 of them, and they were gone within 2 weeks. And people have been pretty good about getting the test done, and we've gotten a couple of hits that are a little above the recommended EPA limits, but nothing too terribly substantial. But that's a great service, and we're happy to be able to offer that. On our website too, there's a video that was recently done by Mindy of our office in conjunction with Channel 79. That is kind of a quick public service announcement about radon and conducting radon testing. We've been doing some videos in the Region 1 with the Region 1 health departments, cooperating and doing myriad of subjects, ticks and restaurant inspections, cosmetology inspections, kind of public service announcements of the spectrum of services that we in local health provide to people. And I'm very pleased with the way the radon, in particular, the radon video came out. A little partial to, our staff. She did a good job. And Channel 79, of course, does great work. Finally, a little bit on preparedness. Kevin, the pod in the box. Apparently, the PO has been issued, and I believe the trailer's been ordered. Do you know anything about that?
Yep. So the trailer is, we identified a vendor. The PO has been issued and is on order. I think the ETA, I heard from Nick, was April-ish. We wanted to get the trailer ordered before we ordered all the supplies, because we would have nowhere to put the supplies. The idea is to put the supplies in the trailer as they come in. The current hypothesis is parking. I think we've worked out a deal with the TPW to store the trailer in a locked gate with a number of other trailers at the DPW site. And then we're going to work on a protocol of how and when to deploy it. It's simple trailer hitch, and there are a number of vehicles in town we can utilize to do that. And we've also, I believe I'd have to check again with Mark McEwen, but ordered the radios because the lead time for those radios is a couple of months as well. So all in progress.
Great. Yeah, and so referencing Mark McEwen, he's circulated the segments of the town's emergency operation plan to all the departments. And Nick and I met to go over our role and the component of the health department activities within that plan. And we should have our part done within the next 2 weeks. That'll include a review of the high school facility as a pod, because prior to the pandemic, we had identified the high school as being our primary point of dispensing for meds, and we've learned that town hall works really well. And the town hall works really well, especially when school's in session. So we're going to realign our plan to have the town hall be our primary dispensing location, with the schools being secondary. And all the staff at the school, since the last time we worked out an agreement with using that as a pod, everybody's different. The facilities director's gone. They now have a different security director. So Nick and I are scheduled to go up to the school in another week and a half, 2 weeks or so, to meet and just kind of, go over our plans and our thoughts as to how to best coordinate things should we ever, hopefully, who knows, if we ever have to do something, to be ready for it.
Good stuff.
Yeah, and there was one other item that I'm not even sure how to present this, but it was I received an email from somebody who wanted to bring an issue to the attention of the board, and I'm not sure if anybody else received that. And let me see if I can pull it up here.
Is this the noise issue around?
No, thankfully it's not that.
I got to talk with you at some point about that, because I have no idea what to do that. I don't think it's even an ABH issue, but
it's not, and we will talk about it.
Okay.
No, this had to do with water quality in the Scott Cove, and the timing is really incredible, because this individual was concerned about the need to do mandatory hookups to sewer if the sewer lines are available, and also to do inspections of existing septic systems to make sure that they're not discharging into our Long Island Sound resources. And of course, our department, in conjunction with Westport and Brantford, have been working on trying to identify sources of contamination in the Scott Cove. And so we have a meeting scheduled tomorrow with Department of Public Health, Thursday, with Department of Public Health representatives, including the laboratory director, to discuss doing some additional DNA source tracking attempts. so that we could actually figure out where the bacteria that are in our waters is coming from. Is it birds? Is it rodents? Is it humans? And so this is that's real science-based evaluation, just to figure out where to allocate our resources. I see Vincent is there, and Vincent sent me the email request that I bring this up to the board.
Could I make a comment? Can you hear me?
Yes.
Yeah, sure.
Well, the comment is really that the best way to test whether there's a problem or not is to have all the private septic systems tested. It's not to have not to evaluate whether there's a problem through any other means, but actually testing Darienne's private septic systems. That's the thrust of my proposal.
Right. Well, I have had a lot of experience working in and around septic systems installation and evaluating septic systems, and it's a very difficult thing to assess whether a septic system is functioning properly. There's lots of ways. You know, if somebody was nefarious in the past and, you know, wanted to hide a non-existing septic system, for example, you know, by running a pipe somewhere, it can be pretty hard to determine. And if you're going to think that we're going to put dye into a line and see it more often than not doesn't happen. So what we're really trying to do with this DNA tracking is if we could take samples of this influent streams, you know, say, or around the boundaries of the property, and establish that the DNA in the bacteria that we find is human, then we know it's their septic system, or we know that it's a septic system in the area. So it can help us localize and be more efficient rather than testing every septic system, which, you know, I don't know how that could logistically be undertaken in a reasonable fashion, you know, time-wise, expense-wise. You know, if you dye test the system, the dye may not show up today, may not show up tomorrow. You don't know when it might show up. So you have to go there, who knows for how long, because it may take a while to seep through the ground. But doing DNA studies will tell us if there's an area that has a problem. So we can focus on that area. And we can say, okay, these areas don't have any problems. So we don't have to spend our time working on these septic systems because there's nothing in the water over here indicating that there's an issue with human DNA in the bacteria that we find there. So that's I think that would be a way for us to kind of target the resources that we have, is to utilize that kind of an approach. But to just go out and test, you know, 150 septic systems, even to do site evaluations for 150 septic systems or however many there are that might be located in a particular watershed, I think is a task that is just, there's no easy way to do it. Let me just say it that way, you know, and it's extremely time consuming.
David, I have to drop. I apologize. You can continue this, but I have a hard stop. But just really quick, continue the discussion. But our next meeting is Tuesday, the 13th. I thank everybody for their time, and you guys can continue the discussion.
Happy birthday, Kevin.
I gotta, you too, bud.
Take care.
Yeah, I have to go too. But thanks everybody. Thanks David, and we'll see everybody soon. Thank you.
All right, do we want to, I guess we're about to lose quorum. So do we want to adjourn the meeting? Did you make the motion to adjourn the meeting, Mac?
Yes.
Okay.
I second it.
Okay. All right. Okay.
Okay. Thanks everybody.
Thanks, everybody.